Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and we're here again on Monday for another one of our live Q&A sessions. This is our chance to interact with you, our viewers, and to answer some of the questions that you guys have submitted onto the videos this week, as well as to answer any questions that you might have live. Remember, you can follow us over on Facebook, Instagram, and Twitter for additional content. Those will be linked into the description below at the end of the video. And we will also be giving you a sneak peek at the video that will be coming out tomorrow. We really appreciate all your support. Remember to like and subscribe to the channel and hit the notification bell so you can get notified when our newest content comes out. So without further ado, as you guys get started, I'm going to go ahead and get started on some of our questions that we got this week. We always usually start with bleeding because bleeding is one of the scariest things that can happen. And I really think that for anybody new who's joining, it's really important to hear some of this stuff that's being asked about bleeding. So we had two questions come in. Hi, doc, I've been bleeding for 2 months, yet I'm pregnant. What can it be? And another one came in that said, hey, doc, my girlfriend is 10 weeks pregnant. And after we had sex last night, she bled a bright red blood. And today she's having light brown blood. Is this a sign of miscarriage? So these are two great questions to start with because they really highlight a lot of what you need to know about bleeding. You know, amongst other things, if you do start to bleed, you want to make sure that you're able to describe that bleeding to your healthcare provider because they're going to ask you questions when you call, and you always call. But during the first trimester, there are many reasons why you might bleed. And one of our questions highlights one of the first reasons, which is you might bleed because you had sex. So the hormones that are needed to have a healthy pregnancy will sometimes thin out the vaginal tissue, making it very dry, and that can cause micro tears that can lead to bleeding. And so that bleeding will show up bright red when it's an active bleed. Now, once the bleeding has resolved, it turns to a brown, and that's why you may see that brownish color, which is also considered, a normal progression for resolving bleeding. But just because you see brown does not mean you should assume everything is okay. You still need to contact your healthcare provider. But sex is one very valid reason why you might see bleeding. Another reason is because you might see bleeding for a subchorionic hemorrhage. And I'll get into more of that in just a little bit because we have some questions on that tonight. You could also see bleeding because you might have a placental issue that needs to be addressed. So subchorionic hemorrhages and placenta issues highlight why it's so important to get checked out, because when we hear that you're bleeding, we're going to want to bring you in and do an ultrasound to see how does the baby look, how does the placenta look, how does the uterus look. Other causes of bleeding could be infection, either in the vagina or the uterus. And you might also see bleeding that you think is coming from the vagina, but is actually coming from a hemorrhoid. Hemorrhoids are enlarged blood vessels around the rectum that can open up and bleed. So these are some of the many reasons why you might bleed. Now, if you are bleeding and your doctor has told you that the baby looks good and you look good, what you need to do at that point is you need to just go ahead and take it easy. Now, this does not mean bed rest unless your healthcare provider has told you that. This means drink plenty of fluids. Make sure that you are taking time to rest when your body's telling you you're tired. Eat a nutritious meal. Try to stay with as little stress as possible. These are the things that are going to help keep things okay. Now, the other thing that could happen is a normal period. Sometimes right in the beginning, your body doesn't quite register that you're pregnant and you'll continue to have a normal menstrual cycle, which is why some women will bleed for a longer time. Just because you're bleeding, especially if you've ruled out medical causes that could interfere with your pregnancy, does not mean the baby is in danger. In fact, there are some women who bleed every day of their pregnancy and go on to have healthy babies and healthy pregnancies. The most important thing with this is that you are in contact with your healthcare provider and you're letting them know what's going on and you update them of any changes. So given that we've talked about that, we're going to go ahead and I'm going to go into the subchorionic hemorrhage, which is something that we had two questions on. So The first question, I'm almost 17 weeks pregnant and I've had mild bleeding. Last week, my OBGYN told me it's a medium-sized SCH, which is the abbreviation for subchorionic hemorrhage. She said to just take rest for 2 days and continue working, but I'm worried about whether I should continue my work or should I take a longer time to recover. The next question said, I have been spotting for 5 days now, but this morning I saw a sac of blood, not to blood of my discharge. I think she's referring to a blood clot. I am on hormones 200, folic acid, and ferrous sulfate, and was injected with Transexum just after the bleeding started and spotting. Is my baby okay with what I saw today, the sac with the blood? Okay, so these are two very good questions. So let's start with what is a subchorionic hemorrhage. So a subchorionic hemorrhage is a kind of pocket of blood that's underneath the placenta. So you have your uterus, okay? And the placenta is the organ that feeds your baby, and it's supposed to attach to the side of the uterine wall. Now, this side of the placenta is full of blood vessels, and this side of your uterine wall is full of blood vessels. And these two blood vessels merge together, and they create this bed where the nutrients and the toxins go back and forth from the baby into your circulation. This is how we feed your baby and grow your baby. Now, sometimes, kind of in the middle or maybe off to the side, a little pocket of blood will form, kind of like a blood clot almost. And so that pocket is called a subchorionic hemorrhage. And sometimes, depending on its position, it will actually leak a little bit of blood and you'll see bright red bleeding. Now, a subchorionic hemorrhage on its own is oftentimes not a big deal. If we find a subchorionic hemorrhage on ultrasound, we don't necessarily have you do anything. In fact, most subchorionic hemorrhages will resolve on their own. Additionally, they get smaller as your pregnancy goes along. So if you have a 2 centimeter subchorionic hemorrhage on your placenta, well, in the beginning of your pregnancy, your placenta is much smaller. So imagine a 2 centimeter in a small placenta is going to actually be really big. But later on, as your placenta gets larger, that same 2 centimeters is a lot smaller. Thus, it's resolving. So usually this is what happens. And oftentimes a subchorionic hemorrhage that's found in the first trimester is gone by the second trimester. So these are things that can resolve naturally. Some women will have a subchorionic hemorrhage throughout their pregnancy, and that is also considered normal. Now, again, this is a pocket of blood that's kind of leaking out. So when your doctor tells you to take a rest, to just like rest and relax for a couple of days, they're just trying to make sure it doesn't develop further. But subchorionic hemorrhages are sometimes something that women will be pregnant with and have no idea they have it until it's an incidental finding on an ultrasound that we do. So they really can be something that you can walk around and live your normal life. And a lot of times you're allowed to have sex and all sorts of other stuff. So I wouldn't necessarily just go to being like off of work because you're worried. And actually, we have a video on bed rest. And I know you're not talking exactly about bed rest, but this is kind of leading into that. Bed rest used to be something that we did all the time for women. And now we're starting to discover that it's actually really not that healthy for most women. And it won't really prevent most complications. Bed rest can put you at risk for blood clots. It can put you at risk for pneumonia. It can cause you to gain more weight because you're less active. It can lead to depression and anxiety. So it's not something we just want to rush into because there are certain things going on with the pregnancy. We need to evaluate everything on an individual basis and even an individual pregnancy basis. One of your pregnancies may be totally uneventful and the next one could be high risk. So this is something that, we take on a case-by-case basis, but it wouldn't just assume that, you need to be on bed rest or something just because of this. Now, as far as the sac of blood, that sounds like a clot. So sometimes this subchorionic hemorrhage will congeal or clot, and now it's a more solid form. And sometimes those clots will come out. Whenever you see a blood clot, you want to make sure that you go ahead and you talk to your healthcare provider. And you want to make sure that you get evaluated to see that that blood clot is normal, that the placenta is still working, that everything is still going well with the pregnancy. Don't just assume you want to get checked out. We will usually do an ultrasound. Some of the medications that you received are not medications that we use here. But, from the sounds of it, it sounds like they were giving you hormones to prevent miscarriage, and that's what we want to do. But definitely after you've been evaluated for bleeding, if you see something going on, you want to make sure that you ask and get checked out. And usually we do a follow-up ultrasound. For those of you who are joining us, feel free to put any questions that you have into the chat. Right now, I'm going to keep answering some of the questions that we had on the videos this week. So we had a question on Placenta Previa, which kind of is, again, part of our whole triad of bleeding and causes of bleeding. So Placenta Previa, can I have a normal delivery? I am in my ultrasound and the results say Previa totalis. I'm happy about my second baby, but I'm also scared. Okay, so now we'll go on to placenta issues. So we have a uterus, and at the bottom of your uterus is your cervix, and a cervix should be long, thick, and closed. Now, you see how my fingers are and how I've got this opening right here? This is actually a pretty good representation of a cervix. You know how we talk about the mucus plug? So your cervix can't be completely closed because it has to open up for your delivery, right? So when you have this, what's going to happen is there's a line of mucus here, which is your mucus plug. When it opens, that's how the mucus plug comes out, right? Okay. Now, your placenta, you got your uterus here. Your placenta usually sits on the side of your uterus, okay? So it's usually something that's sitting right here. And the placenta is something that you want to go ahead and understand that it can be in different positions. So you have your cervix, and the placenta will sometimes sit over it. When the placenta sits over it, this is a placenta previa. This is a total placenta previa. This can be a medical emergency, and is almost always a reason to have a C-section. Okay. Now here's the reason why. Remember what I told you, this side of the placenta is full of blood vessels. So when it's sitting over your cervix, as long as your cervix is closed, everything is fine. When the cervix starts to dilate, now those open blood vessels are bleeding actively into the vagina. This is considered a medical emergency for both you and the baby because you can hemorrhage and the baby can hemorrhage. So it's extremely important for you to go ahead and get this looked at. When we see a total placenta previa, we usually will deliver you by cesarean section around 34 to 36 weeks because we don't want you to have any chance of dilating at all. And for moms who are on their second baby, you can walk around 1 to 2 centimeters dilated and not even know it. And you can have that happen for months. So this is something that we take very seriously. Now, some of you will be told that you have a marginal placenta previa. So what that means is instead of total, it's kind of off to the side. Those types of placenta previas can actually migrate as the uterus moves, okay? So as the uterus grows, that placenta can kind of migrate away from the cervix, and you might be able to have an actual natural birth if that happens, okay? So there's different types, but for a total placenta previa, that is considered something that we're going to have to do a C-section. There's no opportunity for a vaginal birth. Hi, Millennia. So you're 37 weeks now, and your baby is breech. So you will be having an ECV procedure soon. So ECV is external cephalic version. Basically what it means is that they're going to be taking their hands on her belly, and they're going to be trying to move the baby. So breech means the bottom of the baby, the booty is down. Okay, so the booty is facing the cervix. And we don't want to deliver a baby who's breech because there's a lot of risks associated with that for both mom and baby. And so as a result, we need to try to get the baby head down. So we'll do an external version. And an external version is literally taking the hands on the belly and kind of moving the baby around. Now, I'm not sure how it's done where you're at, Millennia, but where I'm at, if you're going to have a version, that's actually done in a operating room. So a lot of women who need a version, we need to be very careful. We need to monitor the baby's heart rate to make sure the baby tolerates the procedure well. Because you're 37 weeks pregnant, the baby's ready to be born if there was an emergency. Some babies will not tolerate the procedure well, and that leads to an emergency C-section, which is why we do this procedure in an operating room with the full operating team ready to go. Now, that sounds very scary, but just so you know, most babies will do just fine. They will tolerate the procedure. The medical professionals who are doing this are trained. They're not going to do this procedure if they haven't done it before. Okay. So they're trained very well. We go slow. We keep an eye on the baby, and everything usually goes according to plan, unless your baby's really stubborn and doesn't want to move. However, a breech baby is an automatic C-section usually, so trying a version is a really good option. The other thing about trying a version is it is better for mom to try to deliver vaginally than to have a C-section. It's much safer for her. So if we can do this, this is really a great option. The other thing everybody should realize is that versions have been happening for hundreds of years. So when women went to give birth back in the day, when you were in your house, in a village, in a cave, if the baby wasn't coming out, if the baby wasn't presenting quite right, then it was very common for the person helping to deliver, usually a midwife, to adjust the baby externally. So this is not a procedure that's new. It's been done for many, many, many years. So good luck with that. I'm very excited for you. Hopefully everything will go well. For those of you who are joining us, please feel free to put your questions into the chat and I will definitely be answering them. Okay, so I'm going to go on. That was a great question, actually. So I have a question about antibiotics during pregnancy. So it says, my wife is 29 weeks pregnant and she was given co-amoxiclav 625 milligrams to take. Is it safe? So this medication is commonly called Augmentin, and Augmentin is a great antibiotic, and I love talking about antibiotics. So antibiotics treat bacteria. They do not treat viruses. They do not treat yeast. They do not treat fungus. However, it is extremely important when you are pregnant to treat any bacterial infections you have. Bacterial infections are one of the number one causes of preterm birth and miscarriage. Your uterus and your vagina need to not have any infection, because if there is an infection, especially in the uterus, it can infect the amniotic sac, which is attached to like the uterine wall, and that can lead to a miscarriage. Now, when we go ahead and we decide to treat, we're looking to use the safest medications possible. So as a result, we want to know what bacteria we're actually treating. What infection do we have? So if you're having any kind of discharge, any kind of smell, anything like that, you need to go to your healthcare provider and have them check you out. Now, in this case, we're going to collect a sample. It's usually using a sterile swab, and it looks almost like a Q-tip. And we basically will take any little bit of discharge you have, and we'll send that sample off to a lab to get tested. Another common cause of infection is urinary tract infections, which are also extremely dangerous during pregnancy. Those, we take a urine sample, we test it for bacteria. If we see the infection is present, we're going to go ahead and we're going to give you antibiotics. Now, how do antibiotics work and antibiotic resistance? I'm sure everybody's heard about antibiotic resistance. This means antibiotics aren't working as well as they used to. Why is that happening? Because people don't take them correctly. So when you have an infection, you have this whole army of bacteria, and your antibiotic comes in to start fighting the army. Now, it starts knocking out the first line, but the back end of this army is watching everything that's happening, and it's trying to develop a strategy to avoid this antibiotic. The nice thing about antibiotics is within like 24 hours, you feel so much better. And pregnant women are often very scared to take extra medication, so they'll stop their antibiotic early because they feel better. But here's the problem. The back end of those bacteria, they start building a wall to fight that antibiotic. And then they call for reinforcements. So now there's more bacteria coming in. And 2 or 3 days later, you feel sick again. So then you're like, oh, I should have taken that medication. I can't believe I didn't. Oh my gosh. So then you start to take the medication again, only this time it doesn't work. This is antibiotic resistance. And this is why it's so important that if you decide to take the medication, you want to take it right away, exactly as you're supposed to take it, exactly as it's prescribed. You don't want to stop and start it. This can actually lead to the infection getting worse and us needing to use stronger medications that may not be as safe as the ones we initially prescribed. Going back to this question, Augmentin is commonly used during first, second, and third trimester, as well as breastfeeding, and it can be used safely. Now, going on from this, we had a couple other questions. We had 2 questions come in on the yeast infection during pregnancy video, okay? So remember, I said that if you think something's going on, any smell, anything, you need to go ahead and get checked out. So the first one says, I'm 16 weeks pregnant and I have a cottage cheese discharge with fishy odor, but no itching. Is this a serious problem? And the person, so a cottage cheese discharge sounds a lot like a yeast infection. Now, yeast infections are usually associated also with some itching, which is why they're a little confused. However, yeast infections usually aren't associated with a fishy smell. Fishy smell discharge is usually bacterial vaginosis. So bacterial vaginosis is a bacterial infection that requires an antibiotic. A lot of people lump it in the sexually transmitted diseases, but it's really not a sexually transmitted disease. It's usually when the vagina's pH balance gets off, and then as a result, this bacteria can grow better because the microbiome isn't working well. So when you have bacterial vaginosis, you actually need to be treated with an antibiotic. A yeast treatment won't work for that, which is why it's so essential for us to swab you. The other thing is, if we don't swab you and you just call up your healthcare provider and you're like, oh yeah, I have a yeast infection, a lot of providers will allow you to use over-the-counter yeast infection products, but not all of them are safe. So you need to be cleared with your healthcare provider. If you just tell them what you have, they're not going to question it. They're just going to tell you what to use. And you could be treating a yeast infection and not treating the other part, and then end up having an infection go a lot longer. So this is, again, why you need to make sure that you're getting checked out. Now, another question that came in said, I'm currently going through the same thing at 32 weeks. I have cottage cheese discharge with a fishy odor, but no itching. Should I take diflucan? I'm scared. So diflucan is an oral yeast medication. Diflucan is complicated. If you guys Google diflucan, which I don't recommend, you're going to find information all over the internet that says it's very safe. And that is partially true. Diflucan, especially in the first trimester, when taken at high doses are considered 400 to 800 milligrams daily, is considered hazardous for your pregnancy. That means there's a high likelihood of high doses of diflucan causing a birth defect. However, low doses during pregnancy can be used very safely and very effectively and are often the best, quickest treatment for a yeast infection. Low doses of diflucan are usually under 200 milligrams a day. So this is why it's so essential for you to have a conversation with your healthcare provider about risks versus benefits, because it's extremely important to understand what your options are. An untreated yeast infection can lead to stillbirth, miscarriage, and preterm labor. Very important to treat. Now, this is another reason why you don't want to just tell your healthcare provider what type of infection you have, and instead you want to make sure you're getting checked out. Now, Our final kind of wrap up with discharge and different things. And please, guys, if you have any questions, please feel free to put them into the chat. We got a question on our STDs, sexually transmitted disease video, and it said, can I prevent a 5-month pregnancy from being infected with syphilis? So syphilis is a sexually transmitted disease. And yes, syphilis can be prevented by taking an antibiotic. It's extremely important that if you've been diagnosed with syphilis, that you go ahead and get treated. Unfortunately, syphilis is becoming antibiotic resistant across the world. And so we've had to use stronger and stronger antibiotics. However, untreated syphilis can lead to serious birth defects and issues with the baby, including long-term learning disabilities and intellectual disabilities. So you need to make sure that you're getting it taken care of. If you've been diagnosed with syphilis, you should not be having sex with your partner until your partner has been treated, because otherwise you will just end up getting syphilis again. Okay. It's a vicious cycle. You must be treated and your partner must be treated. If your partner refuses to get treatment or tested, then you should not be having unprotected sex with that person at this time. Okay. For those of you who are joining us, hi, I'm Dr. Samantha, the maternity mentor. Welcome back for another one of our live Q&As that we have here on Mondays at 9 p.m. Eastern Standard Time. Please feel free to put any of your questions into the chat. And for those of you who stay with us until the end, I'm going to give you a sneak peek at the video that's coming out tomorrow. So we had a great question on RhoGAM and RH factor. And this was actually a very interesting one. And I think it's really good for any of you guys who have negative blood types. So O negative here. I was given a shot at 28 weeks and I am being told about another at 32 weeks. Is this accurate or should I be questioning this more? I knew I would have to receive the first and perhaps another one after my baby's birth, but another one in 1 month span has me questioning. Okay. So I love this question and I would be questioning it too. So RhoGAM is generally given about 28 weeks of pregnancy. We give RhoGAM for anybody who is in negative blood type. So we have O, A, B, and AB blood types, and you're either positive or negative. And when you are negative blood type, if you get pregnant with a positive blood type baby, which can happen, that baby's blood starts circulating through your body and your body can detect it and feel like that baby is actually a foreign object or a foreign disease that needs to be attacked. And so your immune system will basically go into hyperdrive trying to attack the baby, and it can actually lead to miscarriage. So as a result, we figured out that we can give the RhoGAM shot, which helps to calm that down. So any mom who is negative blood type, we give RhoGAM at 28 weeks. And the RhoGAM should last for about 12 weeks. After delivery, your baby's blood type is tested. If your baby is negative like you don't get another RhoGAM shot. If your baby's blood type is positive, then we're going to give you a second RhoGAM shot, again, to help calm down the immune system. You should also receive RhoGAM after any miscarriage that you have, because we won't be able to tell what the blood type was of the baby. Most of the time, that's it. You get one during pregnancy and one after delivery. It is possible if you were potentially going to be having preterm birth and you hadn't gotten the RhoGAM shot. So let's say you were 21 weeks pregnant and you hadn't gotten the RhoGAM shot. It is possible they would give it to you. That's not probable, but possible. And then in theory, you might need it again before delivery. But this is not something I've ever seen. This is not something that I am familiar with. This is not really common practice. So as a result, I would question this. And I think this question really highlights the next part. You guys should be asking when something feels not quite right. If you're not sure, make them explain it to you further. Ask them to do risks versus benefits. Risks versus benefits are so important. Maybe there's something in this viewer's health history that I'm not familiar with, and this is why they're recommending it. And so maybe there's this huge benefit for this one person. And that's why you need to know. You need to know what you're consenting to. Another place that you can ask to get advice on prescriptions is your local pharmacist. Pharmacists oftentimes have they have specialized training in medications and medication safety, and they're a good resource. However, ROGAM is probably not something that they're going to be able to really talk to you about. So I would go ahead and I would just make sure that you're kind of dealing with your healthcare provider. Hi, I see. Hi, I'm 39 weeks and I have an appointment with the doctor on Thursday to discuss about induction because I'm gestational diabetic. How many days does it take to book an induction? So, booking an induction versus having an induction are two different things. So, what I'm going to tell you is this. Booking an induction sounds like actually getting scheduled to the hospital or the labor center. That's totally depends on the labor schedule. Now, having an induction is a different thing. Inductions can actually take 4 or 5 days. There's a lot of factors that go into that, including how ready the cervix is and like what types of induction methods they're going to use. And so it's very important to kind of have this discussion as to what the plan is in order to like tell you that. A lot of people get kind of tired when they're having a 3 or 4 day induction, but I'm going to tell you, I actually think it's a great thing because if your cervix really isn't ready yet, then it's one of those things that, if we just try to rush it, you'll be having a C-section in 24 hours. Instead, using the right medications and taking our time gives you a lot better chance of actually having a vaginal birth. For those of you who are wondering why they're talking induction, when you are gestational diabetic, there's a couple risks right at the end of your pregnancy. For starters, the babies can be very large. So in order to try to have the best chance of, having a vaginal birth, we want to go ahead and we want to try to, get you delivered sooner than later, because the bigger the baby gets, the less likely you are to be able to have that vaginal birth. The second thing is that you want to try to do a birth sooner than later, because unfortunately, blood flow for gestational diabetics is not as good. And so your placenta may start functioning. And so unfortunately, gestational diabetics are at high risk for late stillbirths. So that's the other reason why. So I hope that answered your question, and let me know if you have some other, an add-on to that. I had a question on the benefits of breastfeeding video. So it says, I am breastfeeding and I haven't lost a kilogram in 1 month. I delivered a month back. Also, I didn't lose much in delivery. Overall, I gained 20 kilograms and I haven't lost all of it. When can I expect the beginning of weight loss from breastfeeding? Okay. So this is an interesting question. So not everybody loses weight when they're breastfeeding. This is not something that I think is talked about a lot. In fact, I think everybody says breastfeeding is great because you lose weight. And then it can be very frustrating for some women when they don't lose weight and they think maybe they're doing something wrong. Okay. So not everybody loses weight. It is a great benefit for those people that it happens to. There's no way to know if it's you. Now, one of the common reasons why you don't lose weight is because you're eating too much. So the other problem is they always say you need some extra calories when you're breastfeeding. The calories that you need, like the extra calories, it's like 500 calories. Honestly, it's like half a sandwich or less. It's very small. It's not really a lot of calories extra that you need. Additionally to that, honestly, if you're overweight, if you've gained extra weight, you could actually just not eat those extra calories and you're going to burn some of those off as you're breastfeeding. So not everybody needs to eat the extra calories either, and that could be inhibiting your weight loss. Additionally, many women will develop a thyroid issue after pregnancy. And so if you've developed a thyroid issue, and usually it's hypothyroidism, that can cause you to not be able to lose weight. And it can be hidden because one of the most common signs of hypothyroidism, besides not losing weight, is being tired. And like every mom is tired after delivery. So this is one of the things that I think is, very telling. Okay. So could be the reason why this is going on. So I would definitely look into having your doctor test your thyroid level. It's very common, and I, recommend it for everybody. For those of you who are joining us, please feel free to put your questions into the chat. And for those of you who stick around to the end, you will get a sneak peek at tomorrow's video. And if Aid is still here, you definitely want to know what my video is tomorrow. So I had a couple questions on my sex video, and I love talking about sex because I think it's very important. And I think it's a question we oftentimes don't really talk about. So the first question says, good afternoon from Papua New Guinea. My question is, I'm 5 months pregnant and I'm still having sex with my husband. So is it safe for us to continue? So ultimately, sex, you need to ask your healthcare provider, because I don't know your specific health history. So I'm only going to talk in generalities as far as can you continue. The answer is yes. You can have sex all the way up until the end of your pregnancy. Sex is very safe. It's very natural. There is very little risk to having sex. So a lot of times you'll hear towards the end of pregnancy, if you go ahead and you have sex and you keep the semen, like if you lay back and keep the semen in your vagina, if it soaks into your cervix, it's a prostaglandin, and it can help ripen the prostaglandin to help start labor. That is sort of true. It's not really effective. And so one of the reasons why people will be nervous about having sex is they think that's going to happen earlier. It's not going to happen earlier. Another reason people get nervous is because they're having orgasms, and orgasms are like contractions of the uterus triggered by the hormone oxytocin, which is the same hormone that we use in the synthetic form, Pitocin, to help induce labor. Now, when you're early on, like you're in the second, even the early third trimester, your body's not thinking about delivering as long as you're not having any complications. So you can have as many orgasms as you want, and it's not going to start the labor process. Sex is usually only an issue if you're having complications. If you're having complications, your healthcare provider is going to let you know what you're allowed to do and what you're not allowed to do. And we have a video, I think, on pelvic rest that we'll put into the chat. But basically, one of the things you need to ask if you are told not to have sex anymore is, what does that mean? So there's more to sex than just having vaginal sex. So you might be cleared to have anal sex. You might be cleared to be able to masturbate. You might be cleared to do any number of things, but you can't have an orgasm. Like you might not be allowed to have the orgasm part because of the contraction part. So it's very important for you to clarify with your healthcare provider what that means. You also need to clarify, if you're not allowed to have sex, are you allowed to have penetration? Because we oftentimes will penetrate the vagina using fingers, for example, and you may not be able to have that either. So you need to know, what does no sex mean? Okay, because a lot of women are able to have external stimulation and orgasms safely for their pregnancy, even though they're not allowed to have penetrative sex. Okay. Now, the other question I had on the sex video was, does the vagina get loose after a vaginal delivery, as in never the same tightness? So this is a very, very common question that gets asked. And the answer is, your vagina usually changes. I'm not going to say loose. I'm going to say changes. If you have a vaginal birth, you deliver a, generally speaking, 4 to 10 pound baby. That is going to cause some stretching. The vagina may look different as a result. However, many women will go back to their normal tightness, especially if you do Kegel exercises. Kegel exercises are a form of tightening the vagina's muscles to help tighten everything back up. So it is possible for you to go back to your normal tightness. However, in the beginning, you may be a little loose. That's why it takes a full 10 months to recover from having a baby. It takes 10 months to grow them and 10 months to recover. Your body has a lot of work to do. Now, additionally, when we talk about tightness, let's talk about one of these things that I absolutely can't stand, which is called the daddy stitch or the husband stitch. It's this terrible, awful, barbaric thing that can happen. So if you tear or if you get an episiotomy, and we have videos on that, you will need to be stitched up afterwards usually. So we use sterile thread and a sterile needle, and we put a couple stitches in to help close the perineum. So the perineum is that section of skin between the vagina and the anus. Now, sometimes back in the day, they used to do an extra stitch. It was called, like I said, the daddy stitch, the husband stitch. It's terrible. The idea was to tighten the vagina back up, okay? It was this extra stitch. What we've now figured out is this is an absolutely horrific practice. And it's actually bad not only for women, but for men. So when this stitch is put into place, it basically closes the vagina abnormally small. And as a result, it can be extremely painful for a woman to have sex. Now, that's kind of known. What's not known or talked about as much is it can also be horribly painful for men. If a vagina is too tight, it is not comfortable for them either. That's a fallacy that a tight vagina is the only way to have pleasure. And so as a result, men will oftentimes have severe pain during sex, and it ends up being terrible for both partners. So this practice is barbaric and shouldn't be done anymore, and most people will not do it. There's no health benefits at all to this extra stitch. And I say this because some women are told about it, but they're not told what it actually means to have this, and they'll request it not knowing what they're requesting. Instead, we put the video up there. You just need to focus on good pelvic health and Kegel exercises. That's like the best thing to do. For those of you who are joining us, please feel free to put any of your questions into the chat. We got a couple questions this week on what's the best water to use for formula. As most of you know, I am a lactation consultant, but I am very pro formula. And so I think it's very important for, parents to get all the good information, not just on breastfeeding, but also formula feeding, because however you feed your baby, as long as everybody's healthy, it's good. So first question, what temperature of the spring water should it be for mixing formula? Should it be 100 degrees Fahrenheit? So the answer is probably not 100. Basically, when you're boiling the water for formula, you want it to get almost up to 160 degrees. That's boiling, okay? You would never serve the baby boiling water, but that's how high it needs to be when you're sterilizing. Then you need to let the formula cool. And we tell you to let it cool to approximately lukewarm, okay? And that's usually about body temperature, 98.6 degrees. The best way to do this is to test it on your hand, and you just sprinkle a little bit on. And if it doesn't burn your skin, it's probably going to be fine for the baby. But 98.6 degrees is probably what you want to aim for. Now, remember, you should not be heating bottles into a microwave, because one of the things microwaves will do is they'll create scalding hot spots within a bottle. And so the first little bit that you test could be a perfect temperature, and in the middle there could be water that could burn the baby. Now, the next question was, can I use 9.5 pH alkaline water with a 3-month-old's formula? The answer for that is no. Okay, you are going to find a few sources, very few, that will claim that it is okay. But generally speaking, as of right now, the evidence says you should not be using alkaline water for the formula for your baby if your baby is under 6 months old. Most sources will say not under a year old should you use alkaline water. If you feel that this is incorrect, you need to approach your pediatrician directly to get the advice from them. But I'm going to tell you no. However, as long as you consult with your pediatrician to make sure it's healthy for your baby, after 1 year old, alkaline water can be used, and it is very commonly used, and it can be totally healthy for your toddler. Okay, so that was a great question and not one I commonly get. Going along with bottle feeding, I have a question that said, my baby is preterm and he's coughing while feeding. How shall I feed him? Okay, so when you have a baby that's coughing while eating, you want to use paced bottle feeding. And we have a video on that. So paced bottle feeding is a form of feeding where you basically slow down how the baby eats. So you're starting with a nipple that's basically like half full and the baby's more upright and you're just going very, very slow, okay? And so that's something that's very commonly used and really can help when you're feeding a baby to prevent coughing, because coughing usually is aspiration. This is usually when the baby's sucking down that formula so fast or that milk so fast that they're choking on it. And preterm babies oftentimes have some suck swallow coordination issues. We talk about when you deliver a baby, 39 weeks is full term, 37 weeks is not. 37 weeks is considered a late preterm baby. And these babies, one of the reasons why we want to keep them in your belly is because there's some brain development that happens in the last couple weeks. And one of the things that happens is the suck swallow coordination gets kind of completed. So a 2-month premature baby is going to have a lot more issues with that. Now, additionally to using the paced bottle feeding technique, you want to go ahead and you want to also use the slow flow nipples. And usually a preterm baby like that should be evaluated by a speech therapist. So speech therapists are also feeding specialists. And a lot of times the neonatal intensive care units will have speech therapists come evaluate how well preterm babies eat. So if your baby's still struggling to eat, it's very important for you to go ahead and to get that evaluated. Hi, Gabby. Congratulations. I actually saved your question till the kind of towards the end in case you were here. So Gabby is one of my longtime viewers and she just had her baby. Do I have to boil water every time? Is it okay to use purified water? Yes, purified water is okay. Purified water is one of the things that is actually very good. However, it is important that you are using a purified water that does not add things. So nowadays, guys, there's so many waters on the market. And so it's very confusing, which is why this video is actually one of my more popular videos. Spring water is generally speaking something that is used the most common, to be very honest. Purified water is fine as long as it's not adding in any vitamins or minerals or anything like that. Now, do I have to boil the water every time? This question is kind of a parent's preference. It really doesn't have to be boiled every time, but a lot of parents kind of get caught up in that, oh my God, but maybe I should because I hear I should. So here's the trick to that. To be very honest, the easiest way to handle this, guys, is go on to like Amazon or Target or something and get a big giant thermos, like one of those metal thermoses that are like you can screw on the cap. In the morning, boil all the water for the day, pour it into the thermos, seal the lid, okay? Then you'll have all of your boiled water for the day right there, and you can just use it and pour it in. As the day goes on, that water is going to actually cool, but for a good part of the day, you won't even have to heat the bottle up because it'll already be warm from the thermos water. So that's like a really good trick for just getting your water boiled every single day. Another option that a lot of parents do is they'll get those tea kettle boilers and they'll just boil as they go. So you just turn it on in like 2 minutes, you've got boiled water and you're done. The only thing with those tea kettle ones is you don't want to leave water in it. Every time you want to boil water, you just pour it in. But a lot of parents who don't have a medically fragile baby, I mean, boiling water does not happen for long, realistically. We get busy. A lot of parents, you'll see them pull out a bottle of water and add formula and just shake and go when they're out on the road. So, it really should be okay. And Gabby had asked a question on one of our videos, and she said, I delivered my baby and I'm 8 days postpartum. Do you have any tips for recovering the body? I had a vaginal birth. I'm very sore. I have hip and back pain. This is my first birth, and I've been eating soups and drinking tea and trying to rest. So what I told her was she was definitely doing everything that we want you to do. In addition, one of the things that's so important is you want to make sure that you're getting plenty of sunlight, okay? Sunlight is what we are meant to see in the morning. We're meant to get that bright sun on our face for like at least 15 to 20 minutes. It resets your circadian rhythm. It boosts a lot of the positive chemicals that help to boost your mood. And that sunlight just can be such a refreshing way to start your day. And it's so important when you're tired and trying to do all the stuff you have to do as a new mom. The next thing is keep taking your prenatal vitamin. A lot of people get rid of that the second they're done being pregnant. And if you're not breastfeeding, they want to get rid of it also because a lot of times it makes us feel sick and stuff. Nope. Keep your prenatal vitamin. I tell all my patients who are of childbearing age, ages 15, even if they're not having sex, age 15 to about 45, to take a prenatal vitamin. If you think about it, when you are in the childbearing years, a prenatal vitamin is optimized to your health. So as a woman, even if you're not going to have babies, this is still the optimum vitamin combo for your body during that time. And therefore, prenatal vitamin is what I recommend for everybody during that age. Okay. Next, you want to make sure that you're doing lots of self-care. It is very important that you don't lose your identity in this process. When we become a parent, when we become a mom or a dad, that is a new identity for us, but our old identity still exists. And this is where a lot of moms and dads develop postpartum depression because we feel guilty when we still want to go golfing or we want to leave the baby at home to go spend the day at the spa with my friends because this is what I always did. We feel guilty for those things, but there's no reason to feel guilty. You're still allowed to want the same things you wanted. You're still allowed to do the same things. You just got to balance now. And it's very important that when you're focusing on self-care, that your partner is also focusing on self-care. We spend a lot of time focusing on moms, and don't get me wrong, moms need a lot of support and they're definitely, most of the priority. But if your partner is not feeding their soul, it's going to be hard for them to be a good partner to you. And so this is why it's also important for partners to be able to get some of that self-care in. The most important thing is to take care of yourself. If you aren't taking care of yourself, and that's every part of yourself, then it's going to be harder. The only other thing that I didn't say, but I think is also very important, you want to make sure, guys, that after you've recovered from a vaginal birth, around 6 to 8 weeks, if you are still having any kind of pelvic pain or vaginal pain, that you ask for a referral for pelvic floor therapy. Pelvic floor therapy is a type of therapy that helps to evaluate to make sure the pelvis and the vagina have been healing right. And I think this is something that goes overlooked. I think a lot of women just assume they're supposed to be in pain for a while. And really, you shouldn't have pain like that longer than like 6 to 8 weeks. And even 8 weeks is a long time. And so you want to make sure that if you are having pain, that you can get evaluated by a pelvic floor specialist who can make sure that you've healed properly and help teach you some exercises to improve that. Because otherwise, long term, you could have a lot of issues that we don't want you to have. So that's another thing that I think is very important. Congratulations again, Gabby. It's very exciting to have followed you on your journey as you've been here and to know that you've had that baby. We have 2 more questions for any of you guys who are still on. I am going to be giving you a sneak peek at tomorrow's video. I hope that 8 is still on because you're going to want to know, but let me answer these last 2 questions. So speaking postpartum, I'm almost 10 weeks postpartum and I'm still having intermittent bleeding. So now I'm getting scared thinking it might be a hemorrhage. So hemorrhaging is lots and lots of bleeding, okay? Hemorrhaging is most common when you're just postpartum, like right after you give birth. It's not common, after like 3 or 4 days, but it can happen when you get home. Postpartum hemorrhage is bleeding and bleeding and bleeding. It is not intermittent bleeding. So intermittent bleeding might actually be your body trying to get into your menstrual cycle again. So we hear about menstrual cycles, especially if you're breastfeeding, taking months to come back. But some women will get a menstrual cycle as soon as 4 weeks postpartum. So everybody is different. It just depends. And after you've had a baby, it's very common for your menstrual cycle to change, okay? So if you were a woman who had a very short, light, no pain period, unfortunately, you might now be a woman who has extremely heavy, long, painful periods. You could also be that woman who has the heavy, long, painful periods, and now your periods are like nothing. There's no way to know. It's very hard to predict. But this is one of the things that could happen. However, if you are 10 weeks postpartum and you're having intermittent bleeding, you need to have an ultrasound of your uterus. That is 100%. We can't say for sure what's going on, but a uterine ultrasound can check to see if there's fibroids. It can check to see if the uterine lining is thick. It can check to see if you still might have a little piece of placenta in there, which could cause you to be bleeding still. So it's very, very important that you go ahead and you call your healthcare provider to get an ultrasound. The last question that we had was on second trimester bleeding, and it said, I'm 24 weeks and 3 days and I'm experiencing spotting. I went to the hospital a couple of days ago because I was scared. They checked me and everything was fine. And then I stopped. But 3 days later, I see spotting. Is that normal? I'm really worried. So unfortunately, it's hard to say, who knows for sure what exactly is going on. What I will tell you is if you had bleeding that resolved and now it started again, you need to go get checked out again. The biggest thing that I would be worried about is the placenta. You need to have an ultrasound to see if the placenta is functioning. And guys, at 24 weeks, your baby is now considered viable. This means that if there was a complication and we could deliver the baby safely, the baby could potentially survive outside of the belly. Now, that's an extremely premature baby. That's not a baby we want to deliver at that age, but we possibly could, which is why you don't want to ignore anything and you want to get it checked out. So guys, thank you so much for being here until the end. I want to give you a sneak peek at tomorrow's video. Tomorrow's video is on the medication Cervidil. So Aid, this is why I was hoping you were on and I'm hoping you're still here. Cervidil is one of the most common medications that we use for induction of labor. It's one of my favorites. And so tomorrow's video is going to tell you everything that you wanted to know about Cervidil. Guys, thank you so much for joining me. My name is Dr. Samantha. I'm the maternity mentor. I'm here every Monday at 9 p.m. Eastern Standard Time to answer your questions live. I answer questions that you guys put onto the videos. I answer questions that you put here into the chat. I love doing this. I love interacting with you guys. It's like one of the things that I'm most passionate about, and that's why I'm here to help you guys. We're also on Facebook, Instagram, and Twitter for additional content. We will link those into the description. Please share the channel with your friends and family. Please hit the like button, the notification bell, and please subscribe. And for those of you who are also looking on YouTube, I am now part of YouTube Health, and you guys may be able to find me over there. These are healthcare providers that have been vetted for our licensure and our topic content. And we are sources of material that you can trust. So you can find me as part of YouTube Health. So I really appreciate all of you guys. Thank you so much for joining me. My name is Dr. Samantha, the maternity mentor. Bye for now.